Hey everyone, Dr. Mitul Ajvalia here, board certified podiatrist practicing in Florham Park, New Jersey. Today I want to go over a common source of confusion I often see in my office, which is the difference between calluses and warts. Patients often use these terms interchangeably, but they're actually very different conditions with different causes and, importantly, different treatments. Let's start with warts. Warts, specifically plantar warts on the feet, are caused by a viral infection. The virus responsible is HPV, also known as a human papillomavirus. It enters the skin through tiny breaks or microtrauma, often in environments like pools, locker rooms, communal showers. Because warts are viral, they behave differently than other skin lesions. They can spread either to your foot, other areas of your foot, or to even your hand if you're constantly touching them, or to even other people. Clinically, warts often interrupt the normal skin lines, and you may see small black dots within them, which are actually thrombosed capillaries. So warts have their own blood supply. This is another differentiator between warts and calluses. They can also be painful, especially when squeezed from side to side. Now let's compare that to calluses. Calluses are not viral. They are purely mechanical in nature. They form as a response to repeated biomechanical stress and friction. Essentially, your skin thickens to protect itself from pressure. This is your body trying to help, but it can become uncomfortable or even painful over time. Calluses typically maintain the normal skin lines, and they don't have those pinpoint black dots. The pain from a callus is typically more direct, meaning it's not side to side, but when you push directly. So to summarize the differences, a wart is a viral infection, and a callus is from pressure, friction, and biomechanics. Well, let's talk about the treatments, because this is what really matters here, right? For warts, treatment focuses on eliminating the virus and the infected tissue. Common approaches include mechanical debridement, application of a topical and cryotherapy. Mechanical debridement, we scrape off the thickened skin using a scalpel, and this is typically done over multiple sessions. And we apply a topical salicylic acid to gradually destroy the viral tissue. There's also cryotherapy, which involves freezing the wart to induce tissue destruction. There's laser therapy, which targets the wart more precisely for tissue destruction. And in some cases where the wart is very stubborn, you have to go in there surgically and completely excise it in its entirety. A lot of times with the debridement, it does require multiple treatments. Now for calluses, the approach is a bit different. Since the root cause is mechanical, treatment focuses on reducing pressure and correcting the underlying issue. Mechanical debridement is often performed to remove the thickened skin and provide immediate relief. Biomechanical offloading is also key. This may include padding, shoe gear modifications, or most effectively, custom orthotics to redistribute the plantar pressure on your foot. In cases where there's a structural deformity, such as a hammer toe, bunion, prominent bone, surgical correction of that deformity may be needed to address the root cause. So, if you treat a wart like a callus or a callus like a wart, you're unlikely to get good results. If you're unsure what you're dealing with, it's always best to have it properly evaluated. That's when you come see me. So we get the proper diagnosis to ensure that we're targeting the problem correctly and using the most effective treatment. Thanks for watching, and if you have any concerns about lesions on your feet, don't hesitate to schedule an evaluation. Take care of your feet. They carry you everywhere.